David, take a seat.
Morning.
Great to have you. Okay. Excited to learn more about what Cecelia Health is doing right now, but why don't you just tell us, what are you building? What's up?
So Cecelia Health's mission is to improve the health of people with diabetes and related chronic conditions. Okay. Half the people with diabetes also have cardiovascular and obesity challenges, and we're in a crisis now in the country. There's 30 million people with diabetes, 500 million in the world. In the next 10 years, the CDC says 1 out of 3 people in the US will have diabetes. So we need to do something and really disrupt the environment and help these people. I know firsthand because I was diagnosed with type 1 diabetes at the age of 36. So helping people with diabetes is my mission and the mission of everybody in the company. Yeah. So what we do is we reach out to patients on behalf of our pharmaceutical device and health plan clients, and we engage with them and we build trust in their language, English, multiple dialects of Spanish, and Chinese. We help engage them and teach them how to use their devices, how to take their medication, how to self-manage their diabetes so that they could be empowered in their life and really have a healthy life and a rich life with diabetes and not view it as a burden because it's a tough disease. It doesn't go away.
You know, there's a lot of emphasis at this conference about the patient experience and really understanding patient needs. You were there. You know, take me back to being 36 and getting that diagnosis, and tell me what that experience how that's helped you in running Cecelia Health.
Yeah, I remember the moment the doctor told me that I had type 1 diabetes. I was 30 pounds lighter than I expected. I had no idea why that was, no energy. And the doctor gave me the script for insulin, and I'm like, what is this? I have no diabetes in my family, and I've been a triathlete and runner my whole life. And so I was overwhelmed, and I was really fortunate to meet a great diabetes educator and nurse named Cecelia, who gave me the education, support, compassion, and a sense of empowerment that I could live a rich life with diabetes. And that really transformed my life, and my goal and the company's goal is to bring a piece of Cecelia to everyone with diabetes on the planet.
Awesome, awesome. All right, so let's talk about what that looks like, kind of what the platform actually, how it fleshes out.
So we believe that it's really important to create a personal connection with a patient because people on their own, there's a whole range of people, but the 18% especially who account for 40% of the cost, they need somebody in their corner who's going to help them in their language, on their schedule. And then we integrate technology, as I mentioned earlier, so that we could scale the engagement. They could self-manage. What we're seeing is a tremendous opportunity to go further this year because when you look at a map of the United States, there's only 3,000 endocrinologists for 30 million people.
Oh, wow.
And most of those endos are on the east and west coast. So we're actually going to extend the coaching that we do and move into clinical care, where we can take data from continuous glucose monitors, blood glucose monitors, overlay FDA-approved decision support, and integrate the anecdotal data we're learning from the CDEs and be able to manage the whole patient. So imagine going to a health plan and saying, we'll manage your whole diabetes population and we'll take on risk for that because we're able to engage the patients that cost the most. We're able to remotely monitor the rest of the patients, and by segmenting and using rich data analytics, be able to apply the right mix of digital and human touch and be responsible for outcomes, get the patients healthier, get them empowered in their life, improve quality measures. It's really unbelievably exciting because with 1 out of 3 people having diabetes in the next 10 years, the primary care physicians in this country are going to be overwhelmed. So we need to be able to support them and support the patients.
Yeah, it sounds like a win-win for the insurance providers who are really trying to manage these populations and don't really quite understand, are having a hard time wrapping their minds around how to pull all those pieces together.
Yes.
And you're doing that high-touch care, but also that high-tech platform that pulls it all together and is scalable.
Absolutely.
So what are you most excited about for 2020?
So for 2020, being able to expand our current capabilities with our pharma device and health plans to be able to not only change people's lives through behavior intervention and support, but be able to prescribe and titrate and use this technology to actually be a medical provider, submit claims as a provider. We can create sustainable change across the United States. And if we could change the curve of support and care for the 30 million people and more that have diabetes in this country, we're going to be the number one innovator, disruptor to turn the tide against diabetes and really empower the population.
Awesome.
That's our mission.
Awesome, David. Well, thanks for coming down. It's all the time we have. Wish you the best of luck.
Thank you so much.
And have a great day at the StartUp Health Festival.
Thank you.